to a CBS 2 exclusive. A whistleblower accuses a company in our area of administering diluted doses of COVID-19 vaccine. Welcome back. I'm Christine Johnson.
I'm Maurice Dubois. A lawsuit's been filed against a healthcare company that runs several vaccination sites in the city by an employee who was fired. It alleges that vaccinators at one location were told to over-dilute vaccines.
It's true. What does that mean for people who got vaccinated there? CBS 2's Alice Gaynor looked into this and has this exclusive story.
16,000.
That's how many Pfizer COVID-19 vaccine doses Andrew Palazzo alleges could have been over-diluted and administered at Korean Community Services vaccination site in Bayside, Queens.
When I was the lead vaccinator, I was instructed to have everybody do the over-diluting.
This is direct from the CEO.
Correct. I assumed he was the higher medical authority. I thought it was okay.
Palazzo, who was fired, filed a lawsuit against his employer, Centers Urgent Care based in Middle Village, alleging that while he worked at the KCS site from the end of March until May, CEO Scott Orlansky told him to utilize between 1.9 milliliters and 2.0 milliliters of diluent per vial to obtain at least 7 doses per vial of the Pfizer COVID-19 vaccine. According to CDC guidelines, 1.8 milliliters is to be used. The FDA says do not add more than 1.8 milliliters of diluent. According to Pfizer, after dilution, COVID-19 vaccine vials contain 5 to 6 doses. Back in December, the FDA acknowledged some vials had extra product, tweeting, FDA is advising that it is acceptable to use every full dose obtainable, the 6th or possibly even a 7th from each vial. CBS 2 spoke to several former and current employees. This current vaccinator wanted their identity hidden out of fear.
They heavily pressured the vaccinators to get 7 doses.
Encrypted WhatsApp messages between management were shown to us, as well as text messages sent between vaccinators that show a concern about what was going on. Some went to management.
We said that either they had to stop doing it, they had to correct what this management had been telling people, or we would leave. So a group was going to quit. They agreed that they weren't going to be doing this going forward. They said there had been a miscommunication.
We went to the KCS site to talk to the manager and director.
So you're saying it's not true, then the doses were not?
We never advised anybody to over-dilute anything.
They're saying there was over-dilution going on. You're saying you know nothing about that.
At no time was anybody instructed to draw up more diluent than 1.8 ml.
Dr. Joseph Schenker is the owner and medical director of Centers Urgent Care.
If you're very careful and you're very precise with your measurements, you can get a 7th dose.
Why push for this 7th dose, these extra doses? There's no vaccine shortage.
It's just a cushion. If accidentally there's spillage, if there's a loss of a once it's drawn up, if you accidentally a syringe falls and it has to be discarded. Nothing is used that falls.
Dr. Purvi Parikh is an immunologist with the Allergy and Asthma Network and a researcher on the Pfizer COVID-19 vaccine clinical trials.
If a vaccine is over-diluted, it can lose its efficacy and its potency.
I asked her what could happen if you were to add 1.9 milliliters instead of 1.8.
We frankly don't know because it hasn't been studied if it was diluted slightly a little bit more or not. But just from a medical standpoint, likely in that small amount, it won't make a huge difference.
Now, Centers Urgent Care says it won't comment on Palazzo's termination while there's an active investigation. Palazzo's lawsuit states he wants the site shut down and money for wages lost. The New York City Health Department says senior city staff carried out an unannounced site visit, checked the vaccine, interviewed staff, and observed, and say to date no major issues have been identified. Maurice, Christine?
Okay, Alice, thank you.